Most people think that hearing loss is just hearing loss. They say, I can't hear a few of the consonants like S, F, T, or TH. That's okay. It's no big deal. But what we don't always realize is that we, as people, are an interconnected series of systems. One health system affects another health system. And we're finding that hearing loss is related to a huge number of serious health conditions. Your primary care physician may not even know about all of these. We're finding that hearing loss is related to diabetes. If you have diabetes, you basically triple your chance of having a hearing loss. If you're pre-diabetic, you're just having some metabolic disorders that aren't even categorized as diabetes. You double your chance of hearing loss. There's a whole host of things that will double your chance of hearing loss. Just taking 2 doses a week of over-the-counter pain reliever, such as Tylenol or Advil, will double your chances of hearing loss. We're not talking about overdosing. We're talking about the recommended dose twice a week for pain management will double your chance of hearing loss. So we see a lot of patients with arthritis coming in to see us. They say, is my arthritis causing my hearing loss? Well, no, but the pain medication you're on could be. We also see things you would never think of causing hearing loss being implicated. Viagra doubles your chance of hearing loss. Doesn't affect the ears, that's not why you're taking it, but it's affecting your circulatory system and various other things in your body that can result in a hearing loss. Cardiovascular disease triples your chance of hearing loss. A number of blood thinners will dramatically increase your chance of hearing loss. But more important than anything else, I think, is the emerging literature that's coming out of Johns Hopkins these days that is showing an alarming link between dementia and hearing loss. This is something we really have suspected for a long time, but we haven't been sure about. It appears, with the preliminary data that we're getting, that up to 30% of Alzheimer's disease and other dementias may actually be caused by hearing loss. We don't know this for sure, but that's what the data is looking like. We are seeing that hearing loss is a predictor of dementia. So if you have a hearing loss, first, it puts you at a much higher rate of having cognitive decline later. And as the hearing loss becomes more severe, your risk for dementia becomes more severe. So there does appear to be a substantial amount of literature that suggests that untreated hearing loss may, in fact, cause Alzheimer's disease or dementia. There is a chance that there could be a third disorder that's causing both the hearing loss and the dementia, that causes the hearing loss first and the dementia later. Perhaps cardiovascular disease could affect both systems, but it's increasingly less likely that that's the case. It does appear more and more that hearing loss is causing cognitive decline. What we can't say at this point, and I want to be very clear on this, we do not have the data to say whether hearing aids can prevent cognitive decline. We cannot say that at this point, although there is a long-term study currently being done at Johns Hopkins University that is addressing this very question. It'll probably be a few more years before we have that answer, though.